Good morning, everybody. I introduce myself again. My name is Federica. I work with Professor Bonanni in this private clinic in Florence, in Italy. And I normally deal every day with not invasive procedure. And I'm here today, I'm very glad to stay with you today for speaking about Onda, this new device that it's not so new for me because I've been working with Onda for about 5 years, because we started with a very old prototype 5 years ago. So we really started from zero. So I'm very happy to share with you all my experience with this new technology. I don't know here in Denmark, but in Italy, body shaping is one of the most requested treatment from our patient. So every patient every day needs something to treat fat reduction, cellulite, tightening skin. And for this reason, in the market, we have many devices able to do that. But each one of these devices, for example, cryolipolysis, radiofrequency, high, full lasers, are very good for something specific. So, for example, I'm thinking about cryolipolysis. I have cryolipolysis in our clinic. It works extremely well, but just on fat. So I can treat just very soft and pinchable fat. So I cannot treat cellulite, I cannot treat tightening. Radiofrequency is quite good with not so very great results for tightening. But there is not something able to do the 3 blemishes together, so fat, cellulite, and tightening. Another option surely could be surgery, that it's for sure very effective, but very invasive, expensive, and not every patient wants to undergo such invasive procedures. So let me say that Onda is able to do the 3 blemishes together at the same times. We are working with what? With microwaves, so it's the first technology able to work with this new frequency at 2.45 gigahertz, and we are able to treat cellulite, fat, and locked skin. But the big innovation for me is that we can do the 3 things at the same time. So it means that when a patient comes to me, asking me for fat reduction on, for example, trochanteric area, actually, while I'm doing a fat reduction, I'm working even on cellulite. I'm working even on skin quality, over the same area, during the same treatment, during this 15 minutes treatment. So this is, for me, is fantastic, because we spend more or less 30 minutes for each patient, 4 sessions, 1 each month, giving 3 kind of results, okay? Cellulite. We can treat all stages of cellulite. In my experience, I've seen that the best cellulite to treat, when I have a very big satisfaction after the treatment, is when I have a 3rd, 4th stage cellulite, because the change is really evident already after 1, 2 treatments. So even the patient can feel hair tissue really softer. So the results are visible nearly immediately. A little bit more complicated is when we have a 1st stage cellulite. So when I have water component in the tissue, an edematous cellulite. Why? Because water in the tissue absorbs microwaves. So we could have an energy scatter on water component. I never reject the patient, so first of all, I try to train my patient doing some massage or other devices that you probably have in your clinic. I don't know, for example, I'm thinking about Bella Shape, LPG, other kind of machines able to reduce the water in the tissue. Immediately after, I can do Onda treatments. For fat, we can treat all subcutaneous fat. For sure, we cannot treat visceral fat because it's not possible to go below the muscle, and we don't want to do it. But I even have cryo. Cryo can work on very soft fat because we need to pinch the plica. Here we can treat every kind of fat, very strong and hard tissue, and even very soft and pinchable. And Lux-Skin, for tightening, I think that it's one of the best treatment in the market right now. I performed the treatment for laxity skin in all areas of the body. Recently, we are doing the treatment even on submental area. So for 1 year, I've been working even in this area for fat reduction and tightening. Just to remember that for sure, radiofrequency is the closest frequency to microwave. And radiofrequency range is from 30 kilohertz up to 1 gigahertz. We are working at 2.45 gigahertz. So we are using a very higher frequency with regards of radiofrequency. Well, microwaves are in other objects during the day, for example, in mobile phone, router, Bluetooth, microwaves oven. Microwaves ovens works in a very similar way of Onda machine, and later I will mention how. But why we are using microwaves? Because we have seen that by using this particular frequency at 2.45 gigahertz, we are able to skip the skin. So the energy will be less absorbed by the skin, more absorbed by fat layer. This is possible because skin is like to be transparent with regards of the energy, so I can really pass the skin, skip the skin, and going down fat layer, reaching a very, very high temperature, because in fat layer we reach 55, 60 degrees. So we can really have a fat reduction due to the heat, but very safe for the skin. Visually speaking is this. As I said before, radiofrequency is the closest frequency to microwaves, but the difference is really evident from this picture, because with radiofrequency I deliver the energy in a very superficial way, so the 70% remains in skin layer. Just the 30% through the diffusion can achieve the fat layer. But remember that with radiofrequency, I don't know if you use radiofrequency, we can achieve, I don't know, 42 degrees in skin layer, so in fat layer maybe 37 degrees, it's not enough. With cool waves, we skip the skin, we go down in fat layer, so 80% remains in fat layer, and 20% remains on the skin. How do we reach a strong heating in the tissue? So, Onda is not an air dryer, it doesn't deliver the heat, deliver a magnetic field. So magnetic field arrives in the tissue, so molecules tries to align themselves in their original position, because they try to do a motion of vibration and oscillation. This very strong friction among the cells produces heating at 55, 60 degrees. Okay, this is very boring topic, but very important to understand, because how does it possible that I can achieve more heating in the tissue than in the skin? Because we know that every tissue has two behaviors, conductivity and permittivity. So I know that my target is fat layer. I want to achieve fat reduction. So I have to find a frequency able to skip the skin and to be more absorbed by fat layer, my target. Let me explain what conductivity and permittivity are. So conductivity is how much a tissue can be crossed by the energy, how much a tissue can conduct, can transmit the energy. On the other side, permittivity is the opposite, how much that tissue can store the energy, can absorb the energy. So one is the opposite of the other. So, when we apply microwaves, what happens? Happens that skin has a very high conductivity. It means that as it was transparent, okay? So the energy can filter through it and can go down in deeper layer. This because skin has low permittivity, because skin absorbs very little energy quantity. When we arrive on deeper layer, in fat layer, the behavior is the opposite. So fat has a very high permittivity, so it means that it absorbs the entire energy quantity, like to be a sponge, okay? Because it has a low conductivity, so it's impossible to filter through the fat layer. So for this reason, I'm speaking about a very safe treatment, because I know that the energy always stops in fat layer, okay? For sure, we need to have the fat layer, okay? It's impossible to do a treatment here where the fat is not present. Well, this graph just to understand that when we work with radio frequency that normally work between 27 and 40 megahertz, more or less, you see that the major part of the energy remains on the skin, is absorbed by the skin, and the other 47, 46% goes down. While when we use Onda machine, 6% remains on the skin, 94% in fat layer. So it's really more effective. Okay, some histologies. What happens to the skin? Nothing. So we have the total preservation of the dermis before and after treatment. But if you pay attention, the pink color is completely changed because we even work on collagen fibers. In fat layer, what happens? This histology is fantastic because it's very easy to explain what happened, because we have the total breakage of the adipocytes membrane and a basal hyperemia. Basal hyperemia due to the heat. Okay. This is very interesting. This is what we call blabbing. This is an adipocyte, okay, that reaching this very high temperature start like boiling. So the membrane changes its permeability, and these lipid drops are coming out from the cells. So the adipocytes becomes smaller and smaller. All these lipid drops go in the interstitial tissues. Here are recognized like scraps, so monocytes arrives, they form a multinucleated chain all around the adipocytes, and macrophages start eating all the scraps. Macrophages go into the lymphatic system. So you know that lymphatic system has a very slow circulation. For this reason, I normally wait at least 30 days before repeating another treatment, because we need to give time to our lymphatic system to remove all the scraps. What about cellulite? The same as in fat layer, because cellulite is an inflammation of the fat layer. But in cellulite, we even have these very bad, unfortunately bad, fibrous strand septas made by very strong and hard collagen, an old collagen. So what Onda does? Onda can break the adipocytes that we can reach with the energy, but it can even destroy, denaturate, solubilize this fibrous strand. Okay? So for this reason, it's really, really effective even in cellulite. As I mentioned before, we even have the denaturation of collagen. So we destroy the whole collagen fibers to have new collagen fiber type 3 that is thinner, smaller, but really more elastic. After 2 months, no more inflammation. I never wait 2 months before repeating another session. I wait 30 days, but I strongly recommend to my patient in these 30 days to undergo lymphatic massage or draining devices in order to shorten the time for repeating the following treatment. Contraindications are more or less the same as in other devices. So skin pathologies, over the area to treat, obesity, breastfeeding, varicose veins, pregnancy, and so on. So the same as in cryolipolysis, radiofrequency, and other devices. Frequently, customers ask to me these questions. So, can we use Onda if I have prosthesis? Yes, if the prosthesis is not placed over the area, below the area that we want to treat. YAD, yes, we can use because we don't arise so deep, fortunately. Serious cardiac problem and pacemaker, no, we avoid this kind of patient. Diabetes, theoretically, no, we can't. But if the diabetes is under control, you know the patient, and you treat just one area, so you can really check and control what you are doing, yes, I treat those kind of patients. Obesity, it doesn't make sense because remember that this is a body shaping machine, not a slimming machine. So I can place the treatment in some problematic area. I cannot cover the entire body because we normally treat a square of 15 by 15 centimeters area, and we spend more or less 15 minutes in each quadrant. So we cannot cover the entire body. Yes.
IUD? What is that?
The anticonceptional for women that we implant in the uterus, yeah. But it's impossible to reach this layer, so no problem. Pregnancy, no. Breastfeeding, no, during the period when the baby feeds on mother's milk. So if baby has, 8, 9 months, we can do the procedure. Skin pathologies, yes, if the disease is not on the area that we want to treat. Well, we have understood what Onda is. Let me explain how Onda works. Before, I mentioned a comparison between Onda and microwaves oven that you probably have in your kitchen for eating the food. Well, the mechanism is very, very similar because even the oven works at 2.45 gigahertz. And what happens when you put a cup of milk inside your oven? Milk becomes very hot, reaching very high temperature, but the ceramic cup remains warm. And it will be warmed up by the hot milk, not by microwaves. So the concept is the same. When I'm in contact with my handpiece, with the skin of my patient, I can overheat the fat inside, so the fat will reach very high temperature, but the cup, in this case the skin of my patient, will remain just warm. And the skin will be warmed up by the hot below. Well, the concept is the same, the way of delivery the energy is completely different, fortunately for us, because in the oven, microwaves pump free everywhere. Here we can really check and control where microwaves are going to. Why? Because in each handpiece here, we have 2 electrodes, one here in the middle and one in the external area. The one in the middle pushes down the energy into fat layer, into a certain depth. The other one recalls back the waves. So we really have a very close energy circle emission. So we really know where microwaves are going to. So it's really safe, even for us, that we work every day with this handpiece. Because if I'm not in contact with the skin, the second electrodes immediately recalls back the waves. So I won't have energy scattered in my room or in the body of my patient. Okay? Well, when I, with the first electrode, reach the fat layer, molecules try to move to make this very strong friction, and I produce the heat at 55-60 degrees. Well, this heating won't remain here in the precise area that I'm moving, but I'm gonna have a very great diffusion of the heat. So the heat will go in the surrounding area, always in fat layer, because we have already said that it's impossible to cross and to filter through the fat layers. So muscle are not involved, organs are not involved, the bones and glands. This aspect, this diffusion, is a very good point for us, because even if I'm treating a very quite small area, 15 by 15, at the end of the path, I'm going to have very great results even in the surrounding area. So frequently happen that when I treat belly area with 2 quadrants, I'm going to have fat reduction even in the flanks, even in bra line, because I have a neat diffusion. So be careful when you have to decide how many squares, how many quadrants to put on your body patient, okay? Well, it goes in the surrounding area, very good. But it even goes toward the skin. This could be a problem. Why? Because 55 degrees temperature is too hot for the skin. We could cause a burnings from the inside. For this reason, on the top of the handpiece, in the external area, I have a very strong cooling system that I strongly recommend to maintain at 5 degrees. These 5 degrees on the cooling system can perfectly balance the 55 degrees that are coming up toward the skin. At the end of the treatment, I'm gonna have 42 degrees on the skin. Perfect temperature. So for this reason, I insist and I repeat many times, I'm boring for this, that I always perform 3 treatments at the same times. I'm doing fat reduction. I'm working on fibrous strand septa if the patient has, and I'm working on collagen. This is the cooling system that I mentioned before. And this is a sample, because don't do it, never. If we stay still, we can reach very high temperature here in the middle, about 70 degrees, staying still, while in the surrounding area, in the light blue color here, the temperature will be lower. Why? Because it's where the cooling system is. So what does it mean? That it's forbidden to stay still, for sure, in order not to burn the patient, and is strongly recommended to stay always in motion in order to cool down the skin. So while I'm doing the treatment, I'm not thinking about how I'm eating the fat. I always think about how I'm cooling down the skin, because if I perfectly cool down the skin, my patient can tolerate more, I can deliver more energy, I'm gonna have more results, okay? We have 2 handpieces. I know that some of you already use Honda, so probably you know these things. Anyway, 2 handpieces, well, both of them can do the same things. Both of them can work on fat reduction, cellulite, and tightening. The difference is the penetration. So we have 16 millimeters penetration with deep and 7 mils penetration with shallow. So what does it mean? That when I have a big tissue to treat, a lot of fat, I'm gonna treat with deep in order to go deeper. If I have a thinner layer of fat or just loose and flabbiness, I'm gonna use shallow. But this is curious. For example, when I have a very bad cellulite, a third, fourth stage cellulite, with a lot of fat on trochanterus area, for example, I would think about to use DEEP. A lot of fat, a lot of cellulite. No. When the cellulite is very fibrotic, very strong, very hard, I always start by using shallow. Why? You have less penetration. Why are you using shallow? Because thanks to the narrower diameter, the energy power is really more concentrated. So I can really be stronger in the tissue, okay? In particular on cellulite. So I normally perform the first or even the second treatment with shallow. When my patient will come to me saying that, okay, I feel my tissue really softer, and I can touch her tissue and became really softer, at that point I can start using DEEP handpiece. On the top of the handpiece here we have a very clever and important LED light color that can warn me if I'm doing good the treatment or not. So if the light is green, it means that I'm doing the treatment in a very good way, so I'm well in contact with the skin. If the light becomes red, it means that I'm losing the contact. So I have to fix the position of my hand maybe, or maybe it's not the proper handpiece to use, because sometimes happen that, for example, I use DEEP handpiece and it's impossible to find the contact. So I change and I try to use the other one. Okay, now let me play with some comparisons. As I said before, the closest machine to us is radiofrequency, but let me explain. With radiofrequency, here we have a bipolar radiofrequency. The energy can go in a very superficial layer, reaching 42 degrees. So you see that fat layer is completely not involved at all. While when we use Honda, what I explained before is that we send the energy by skipping the skin. We go down in fat layer, reaching 55, 60 degrees, and then all this heating goes up toward the skin, reaching 42 degrees on the top of the skin. For this reason, we work always in fat layer and in dermis and epidermis layer. Another comparison is versus ultrasound. We have understood that with Honda we always stop in fat layer, so it's impossible to filter through it, so it's a very safe treatment. With ultrasound, actually we don't know where ultrasound stop. So in my experience, I've even seen very bad depressions, holes caused by ultrasound, cavitation, for example. So it's not so safe treatment. Another kind of ultrasound is HIFU, that surely is safer because we know that focalized ultrasound stops in a certain depth, but we can treat very small dot, very small area. So for treating a wider area, we would need a long time, and it's quite painful for the patient. The last one is versus cryolipolysis. Well, I have it, so I love very much cryolipolysis, but it has a very big limit. Because if 10 patients come to me asking for cryolipolysis, maybe I can do the treatment at 2 people maximum. Because to be effective, I have to looking for the good patient. And good patient for cryolipolysis is a patient who has very soft and pinchable fat, but not too much soft, because if I have too much laxity, I can get worse with laxity. So it's very, very difficult to find the right patient for cryo. Cellulite cannot be treated because we have no results, very poor results with cryolipolysis on cellulite. Loose skin, flabbiness cannot be treated. So it's very difficult to sell this kind of treatment. While with Onda, I never reject any patients because I can treat every kind of fat, every kind of cellulite, and for free, I give to my patient tightening results. Well, some of you has cryolipolysis in your clinic? Okay, we can combine the two devices together. I have both, so I play with them. For example, if I have a very good patient for cryo, I apply cryo, soft and pinchable tissue. After that, sometimes patients, I don't know you, but complain about the flabbiness after cryolipolysis. In particular, some people a little bit more aged. After that, I start with Onda machines for a further enhancement on fat reduction and to achieve tightening results. Okay, how to do the treatment? It's very easy. I always mark the quadrant 15 by 15 with a pen and a ruler. How many treatments? Depends on the patient. Average 4 treatments every month. Where to place the quadrant? Those are all the areas that we can treat. It doesn't make sense to treat this area because in this area we normally have edematous component, water, so we cannot treat with Onda. Remember the diffusion of the heat. I treat for each treatment maximum 6 quadrants. 6 quadrants, it means 1 hour and a half. So it's quite a long treatment for the patient, but even for us, and even for the lymphatic system. So I normally stop at 6 quadrants in a path of 4 or 5 months because I don't want to overcharge the lymphatic system. And if I'm treating 6 quadrants, I repeat the following treatment after 45 days. So I give more time to lymphatic system to work, okay? While if I'm treating 4 quadrants, I wait 1 month. Well, when you switch on the machine, you will see this, body contouring, cellulite tightening. Well, it doesn't make sense because actually, as I repeat many, many times, we always perform the 3 things together at the same time. So I normally suggest to set the machine by yourself. First of all, we have to select which handpiece to use. So a lot of fat, soft fat, deep. Little fat quantity, shallow. Laxity, shallow. Cellulite, very strong, shallow, and then deep. Then I set the machine. It looks difficult, but it's very easy. We have 2 main parameters, power and dose. Let me explain. Sorry, too fast. Dose is the energy quantity that I want to deliver in 1 quadrant. Power is the strength, the speed that I use to push down this energy in the quadrant. So, for having better results, I want to increase the dose, not the power. The power, it would be better for me to put the maximum power at 200 watt to take less time, because the speed will be faster, so I will take less time. But the patient will feel a very strong heat. So I need to play with the power based on my patient tolerability, okay? The time is the results of these 2 parameters. Device suggests normally these very conservative and safe parameters. I always increase a lot. I've been working with this machine for 5 years. So at the beginning, I recommend to start from database, and then when you will have more experience, you can raise up the parameters. More or less, the dose I increase if I have cellulite, third, fourth stage, or a lot of fat, I increase nearly the double. 150, 170 joule, okay? I see some very scared face.
Well, we've just been told the 10% maximum, so that's why I'm surprised that you can use so much.
Yeah. By using this dose, I need to increase even the power. Because if I leave the power 130, I will take 25 minutes in each quadrant. So cellulite, much fat, this the dose, this the power. Or if I have flabbiness, little fat, this is my dose with this power. Okay? But you need to play with your patient. So I want to finish the dose that I set because I know that the dose will give me the result. The power, it depends on the patient. I have some patient that with 170 watt fall asleep, and other patient that with 140 they cannot tolerate. So I need to adjust the power. In the worst case, I will take a little bit more time to finish the treatment. What else? The time should be more or less 14-15 minutes in each quadrant. You can select the handpiece, the temperature. I always leave 5 degrees temperature, but a little tip and trick. If I'm quite confused, so my patient has a lot of fat in the belly area, but as you know, you are very, very thin. So a lot of fat, but even a lot of laxity. I know that for fat reduction, it would be better deep, because I go deeper. But for laxity, I know that shallow is stronger. So what I do is to use deep and peace by increasing the temperature. Because, I explain, deep and peace is really more tolerable by the patient. Even if it goes deeper, it's more tolerable. Why? Because it has a bigger cooling system, and because it goes deeper, and remember that the sensorial receptors are in the superficial dermis. So heat takes more time to go up toward the skin. So the patient can tolerate more. For the first 5-6 minutes, patient will feel nothing with deep and peace. When I use shallow, that is, the cooling system is smaller. It goes less deep, so it goes up toward the skin faster. Immediately the patient warns me about the heat, after 1 minute. So what I do is to use deep and peace with a higher cooling system temperature. In this way, I will remove less heat from the skin. So I'm gonna give more tightening. Quite clear? So when I have fat and flabbiness, I use deep and peace, increasing the cooling system temperature. During the hands-on will be easier to understand, because if you agree, I can try on you and I let you feel the feelings, okay? Okay. Adverse reaction. Hematomas, I've never had, but some doctors had some hematomas. I think due to the pressure of the handpiece, because the handpiece is quite heavy, so we don't need to do any pressure. So just moving, just sliding. Redness due to the heat. Slow pain over the treated area during the following day, but very slight pain, nothing compared with cryolipolysis. Nodules. Nodules sometimes occur. Why? Because when I exaggerate with the dose, and I always do it, We can have during the following day these nodules due to the fact that the free fatty acids, lipids are free in the tissue, and macrophages are not able to recollect all the scraps. So don't worry, the nodules fade in 3 weeks, 4 weeks, 2 months, depending on the patient and depending on what the patient does. If the patient undergoes lymphatic massage, training devices, nodules fade in 3 weeks. We need to wait that the nodules fade before repeating the treatment. How long should we wait between each treatment? As I said before, at least 1 month. If I treat 2-4 quadrants. If I treat more than 4 quadrants, I normally wait 45 days. For lax skin, and I mean a very lean woman, for example, in the arms, I'm thinking about arms, with very little fat quantity, so it means that my parameters are very low, I can wait a little bit less, 3 weeks. I strongly recommend to undergo lymphatic massage or draining devices, drink a lot of water in order to help the lymphatic system to work faster and better. The only consumable, fortunately for us, not for you maybe, is Vaseline or paraffin liquid oil. That's it. As I mentioned before, during the last year, we started the treatment even in double chin area. We can perform the treatment just with shallow handpiece because we want to penetrate less in this very sensitive area. I can perform the treatment just on those patients who have quite fat. So if I have just flabbiness and no fat, we cannot do the treatment. Because remember that the energy stops in fat layer, we need to have the fat. The area where to move is not a 15 by 15, it's a very smaller area, so the movement will be like this. For this reason, we reduce the parameters. This is the dose compared to 150, and this is the power. The time will be more or less 20 minutes in double chin area. Maybe this is a video. Maybe no. No. Some results. Okay. Now there is the most interesting part of the presentation. This is after 3 treatments, double chin area. This is after 3. Again, 3 treatments. This is 4 treatments. You see fat reduction and tightening effect. Double chin area is treated every 3 weeks. 8 weeks after. This is another case after 4 treatments. This is Quantificare. Even us, we have Quantificare in our clinic. It's a very good way to take picture. You see from the clay picture, we can see even the tightening on the skin and fat reduction after 2 treatments. This is after 3. Surely she needs more, but anyway, even after 2 treatments, is very evident. She lost 17 cc of fat. Now we move to the body. Okay, this is a fat reduction in ultrasonography picture. Okay, this is after 2 treatments. What I said before is that it doesn't make sense to cover the entire leg of squares. For this patient, we placed 1 square here, 1 square here. Because trust me that we have a great diffusion of the heat. Here we treated the inner knee part after 2 treatments. For lean patient, it's more difficult because they have very little fat quantity. So we need to reduce the parameters because these parameters for me are very low. Anyway, the result is visible after 2 treatments. She's the same patient. You see that the fold is completely different. And I always take picture after 1 month after the treatment, not immediately after. Too easy. Trochanteric area in a very young woman. So you see how these holes, depressions in the tissue can improve. Okay, this patient was for surgery. We suggested surgery for her. She didn't want, so we performed Honda treatment and she lost 4 centimeters of circumference in each leg. This is a patient who treated trochanteric area and inner thigh. Very young patient even here. For her, I suggested 4 treatments. Actually, after 2 we stopped. Trochanteric area. This is unbelievable. The response of the patient is based on the patient lymphatic system even. Because, for example, for her, we treated this area, placing the quadrant in the middle, and thanks to the fusion of the heat, we had very nice improvement on the entire thigh. This is after 1. After 1 treatment, this is very interesting because you see that we can really work even on fibrous septas of the cellulite. This is after 2 treatments in trochanteric area, 3 treatments. This is just after 1, just to show you that on some patients, not every patient, we can really achieve evident results even after 1 treatment. After 1, some lights are very bad, I know, but we are trying to improve the picture's quality. This is after 3, just 1 quadrant on the upper knee. Even here, I placed just 1 quadrant here, 1 quadrant here. Well, when we have a stronger cellulite, very fibrotic, we need to insist a little bit to see evident results. After 4, 3 treatments. This is after 4 treatments. She lost 4 centimeters on the left and 2 centimeters on the right. And now we are doing the treatment just on the worst part to adjust the difference. She's the same patient, side view. Even the skin quality completely changes. This is after 1. This is wow. 2 treatments. 1, but you see my 4 people who are using Honda, you see that my parameters are crazy, okay? So start a little bit more dose, more power, less, sorry, not more. More than this, it could be a problem. This is after 1. 1 treatment, knee area. This is after 2 treatments. This is after only 1. Very nice. And we treated just 2 quadrants. Normally on belly area, I put 1 quadrant here, 1 here. If the patient is very tall, I put the 3rd quadrant in this area. But you see that after 1, we had fat reduction, but even a slimming here in the waistline, and even the flanks improved. This is the side view. This is after 2 treatments, fat reduction and tightening. And she told me that her weight was the same. This is interesting. Okay, this is a very particular case. So for this patient, I did, I think, 4 treatments. This is after 2 treatments. And you see that she got fat reduction, but even tightening effect. And you know that with radiofrequency it's impossible to achieve this kind of results. Even this is unbelievable after 3 treatments. This is a combination between microwaves. She had a very bad liposuction 8 years ago. So she had these very cicatricial tissue nodules in the fat layer. So we improved a lot the situation, and we did even a fractional CO2 laser. This is the signature of CO2. This is after 2 treatments. She lost 9 centimeters in the upper part and 5 centimeters in the lower. Here's my poor brother that during the clinical study he underwent the treatment, and after 2 treatments we stopped because now he has just visceral fat. Okay, so we can reduce the subcutaneous fat. Another case of tightening result, 1 treatment for fat reduction. Sorry, this is the same. Bra line area, she lost 2 centimeters and a half in 1 treatment. Okay, this is particular case. She underwent cryolipolysis, and I was very happy because she lost many centimeters, but she complained about the skin. She said to me, I feel my skin very soggy, very empty. And we performed 3 Honda treatments. She had further enhancement on fat reduction. You see the waistline even. The belly button is upper. And the tightening is evident. This is after 2. This is very curious. That patient underwent 4 treatments. Quite good result, but this patient after 1, it's unbelievable. So it depends on the patient, it depends on the fat, it depends on the lymphatic system, but in particular on fat, because she had very soft fat. Response is faster. When I have stronger fat and hard fat, I need more time, more session, and the results will be a little bit less. This is after 1. She was one of my first patients in Honda treatments, and I was really surprised because in that period I was used to repeat the treatment after 2 weeks. Mistake. And I realized the mistake with this patient, thanks to her, because she came back after 45 days. And I said, wow, because the weight was the same, but she lost 4 centimeters of circumference. I placed for her 4 quadrants, because she's very, very tall, with less dose in each quadrant. But you see that thanks to the heat diffusion, we really had a nice improvement even in the flanks, in the waist, and in bra line. But I treated just the belly area. For sure, if I do 1 quadrant, I won't have a nice diffusion of the heat. So it depends how many quadrants you use. This is a diabetic guy that for 70 years made injections in the same part of the belly. So he had a very cicatricial tissue. And with shallow MPs, we improved a lot. Very lean woman, so clinical manual says not to do the treatment if you don't have at least 2 centimeters of fat. Knowing the machine very well, you can adjust the parameters and you can treat even this kind of patient after 3. We will spend more sessions because you have to decrease the power, okay? Always with Quantificare, we had this very good picture. After 2 treatments, she needs more for sure, but anyway, the results is incredible after 2. Even in bra line, she improved, but I treated just the abdomen. You see? She lost 5 centimeters in the middle, 42 millimeters, 48. Another good case. She lost 5 centimeters, 3 sessions. Arms, 3 treatments, 3 sessions even here. I put again this picture. Okay, I finished the presentation. If you have some doubts, questions, curiosities, I'm here for you today, so... I was very clear.
One question.
Yeah.
You talk a lot about when you have treatments that you add
Mm-hmm.
on the deals. On what grounds do you make that decision
About what?
about increasing the power?
Trying every day. So even thanks to the factory, to Deca, that improved a lot the cooling system. Because at the beginning, the cooling system was not so effective. So patients were not able to tolerate the treatment. So at the beginning, we started with the parameters set by machine. Then, increasing the quality of the cooling system, I've seen that my patient could tolerate more. So I tried to increase a little bit day by day. And at the end, I found these parameters that are
important to have that dialogue with, with the patient as well. How do you feel?
It's very important.
Take some more, or are you comfortable? Do you feel heat?
Absolutely. And remember that by using these very high parameters, we need to wait a little bit more before repeating the treatment. Because it doesn't make sense to repeat a treatment after 2 weeks, because I have a very high inflammation in the tissue and I'm not able to see the result given by the previous treatment. So it doesn't make sense. And even at the end of the path, for example, after 4 months, after 4 treatments, the patient will see more results during the following period. During the following 2-3 months, she will continue to see results improving day by day. So this is very important. Even for massage, you mean? Yes, I suggest massage, I suggest doing exercises and so on. But anyway, it works in a very good way even by itself. Because I have many patients who say to me, I eat, I drink, doesn't matter if the treatment doesn't work, but anyway, the treatment works. For sure, if my patient will help me, it would be fantastic. No? And yes, so my suggestion is to start from database, increasing little by little, asking to the patient. But remember that the result is given by dose. So if I increase the dose, my patient can perfectly tolerate. For sure, I would like to increase even the power to take less time. But for increasing the power, we need to ask to speak about the patient. Can you tolerate? If I increased too much heat, you can go on. So this is very, very important. Well?
Question?
Question.
Yeah.
You have explained about fat cell releasing after treatment and macrophage.
Yeah.
Could you explain a little more about that?
Yes, we are doing a lipolysis, so we are doing an apoptosis. Actually, it's a little bit apoptosis, a little bit necrosis. So when I spoke with the doctor who made the histologies, he explained that we are in the middle, because speaking about just apoptosis is not correct, because we have the breakage of the membrane, because histology shows the breakage of the membranes. But this breakage is very slow procedure. So it's not so fast as in necrosis. So it's enough. We have the releasing of free fatty acids inside the adipocytes, the lipids that are coming out. So all this fat has to go somewhere. It goes in the interstitial tissues, and then macrophages try to recollect all these free fatty acids. For this reason, I remark not to do more than 6 quadrants, because in my opinion, the best way should be 4 quadrants, in order not to get free all this fat, in order not to have nodules. Nodules are a consequence of these free fatty acids in the interstitial tissue. Very important even to ask to our patient if they have some problems in English, liver or RENI, I don't know how to say in English, sorry. So this is very important to do a consultation before the treatment. And drink a lot of water is very, very important in order to help the lymphatic system. And I've seen, because I did a test on 10 patients with lymphatic massage, 10 patients without lymphatic massage, the difference was very evident. Because doing lymphatic massage, Voder massage, that it's a medical massage, can really help the lymphatic system. The patient who underwent lymphatic massage never had nodules. So this is very important. We've never had in 5 years problems with the free fatty acids and lipids in the tissue. The half of the fat that got free go away in lymphatic system. The other half is stocked in energy. So for this reason, I insist with my patient to do exercises, to walk every day, to try to work on this energy accumulated in the fat. Yeah, this is very important.